Hi, I'm Shankar Thiagarajah and I'm a consultant orthopaedic surgeon with a special interest in hip and knee surgery. I'm a founding partner of Coriel Orthopaedic Group and my NHS practice is based at Doncaster and Bassetlaw Teaching Hospitals. I see patients privately at the Coriel Clinic, Park Hill Hospital Doncaster and Thornbury Hospital in Sheffield. I completed my orthopaedic training in South Yorkshire and completed 2 senior hip fellowships. The first was in Toronto, Canada, where I spent 12 months with hip and knee replacement and revision surgeons. And the second fellowship was in London, covering all aspects of hip preservation surgery in young adults. I treat a wide variety of conditions ranging from hip problems in young adults to arthritis in older patients. And the operation I perform most frequently is a hip replacement, and that's an operation that I performed over 170 times last year, which is well above the national average. I pride myself on providing a personalised service, employing the latest evidence-based practices, and I try to focus on the real issues for that patient and identify what their hip pain is preventing them from doing. Often that treatment is non-surgical, and we would always advocate starting with that before contemplating any surgery. The old adage of you're too young for a hip replacement has now gone, as the techniques and implants we use now can last a lot longer than previously. Patients can return to a really high level of function, including running, cycling and sports such as tennis. Procedures I perform include hip and knee replacement and hip revision surgery. Revision surgery takes place when a hip replacement either wears out or reaches the end of its life expectancy. Additional procedures I perform include hip arthroscopy or keyhole surgery to the hip, and these are for conditions such as hip impingement. Finally, I perform osteotomies to both the femur and the pelvic bone for conditions such as hip dysplasia. An osteotomy is a procedure whereby a patient's bone is cut and reset, thereby correcting a deformity in its shape. If you have any issues with your hip and would like to know what treatments are available to you, then please get in touch with us here at Coriel Orthopaedic Group.